An increase in the number of COVID deaths and a spike in the number of positive cases over the last week indicate that we may be at the beginning of the second wave of a pandemic. Mayor de Blasio has proposed taking some pretty drastic measures to stop the spread. The city's Test and Trace Corps tracking it all for you. Dr. Ted Long and his team at the city's Test and Trace Corps, they are tracking the numbers very closely, and the doctor joins me live right now. So good morning to you, sir.
Good morning. Thanks for having me.
Thank you for being here. So I haven't asked this question in a long time, and it involves numbers. Were there any new deaths and COVID cases reported yesterday? And if so, how do they actually compare from a week ago?
Yeah, that's a good question. The way coronavirus works is you first see it transmit within a community, and then you see hospitalizations, and then you see deaths. Right now, we're seeing clear transmission in our communities.
Yeah.
In our outbreak areas, in our clusters, we're seeing 3 times the number of cases we were seeing before. Now we're starting to see an uptick, a small uptick in hospitalizations, but we have time to stop it, to control it, and we've given a decisive and focused plan to the state that we're confident can accomplish this.
Yeah, I think people are really worried here because when you hear about the small uptick, that's how this all began, right? With the small uptick in February and March as well. When you look at these communities and you see numbers like 8% positivity rate and these specific zip codes I'm talking about, do you see a commonality between what is happening in Queens and Brooklyn?
Yeah, so we've seen upticks before. Look at Sunset Park, look at Soundview. In each of those, we have a focused approach where we bring in a ton of testing, we do in-person contact tracing, and we drove down the percent of people testing positive by 2/3 in each of those respective communities. Now we're seeing multiple upticks at once. And we're bringing in all of our usual resources. We doubled the number of tests being done across these zip codes in one day alone on Friday. But they're happening at once, and we need to go further. We need to take that next tool out of our tool belt, and that is limiting how people can interact with each other such that we limit transmission.
Right, but I'm asking about a commonality, right? Because you test and trace and you talk to people who are testing positive. Is there a commonality between these neighborhoods?
We're seeing a lot of close contact and household transmission, but that's how it starts. The commonality is that we're seeing the virus levels start to creep up, and it starts slow, but then it accelerates from there. And we're seeing a similar level of acceleration across communities. So we know something's happening at the same time. So this is the opportunity now where we need to clamp down and where we need to impose the restrictions that we've talked to the state about.
There's been plenty of time to figure out testing, right? I know you guys have been working hard at infiltrating communities with testing. Once you get tested, how long does a person have to wait to get the results, whether it be positive or negative?
Right now across the city, we're at 2 days. However, if you right now we have 4 rapid testing sites, soon to be 12, in the zip codes, in the communities that we're talking about in our clusters, where you can get a result back within 15 minutes. Go to NYC/COVID test to find a site near you, and you can either get a rapid test or a result back within 1 to 2 days.
Are you, what do you think of this situation right now? Good morning to your dog. And what do you think right now of the situation of closing down these neighborhoods, right? We saw in the very beginning, the first cluster ever was in Westchester, and there was this quarantine zone, right? Should that happen right now in these specific neighborhoods? Because closing down schools is one thing, but people can still travel, right? People can still go from community to community and shop at other places if they have to, if their business is closed in their neighborhood. So what are your thoughts on that?
The principle behind how to address COVID is there's no one thing you can do that's going to be a panacea. So if you close down any one business, it's not going to solve the problem.
Right.
It's the totality of things between closing down opportunities where people interact together and can transmit the virus, plus getting tested, plus wearing masks, plus doing contact tracing. So you have to think of it as a collective approach. And to be clear, closing things like non-essential businesses is one way to limit how people are interacting together and that opportunity for transmission. So it is important, but it's part of a bigger picture.
Donovan Richards, councilman from Queens this morning, he is impacted by this, what's going on in his borough and his communities as well. He actually criticized Test and Trace, and he said this morning about an hour ago that he doesn't feel the Test and Trace members are from the community and therefore don't understand the communities that they are actually infiltrating. Your response?
Yeah, so one of the things I'm most proud of, and I think our secret ingredient to how we've achieved the lowest levels of the virus of any major city in the country, sustained for a matter of months, is that more than 50% of all of our tracers are from our hardest hit communities and understand what it's like to have gone through the horrors of March and April. And what I would say directly to Councilmember Richards is I agree that we want to have as many people from your community as possible. Send me their names, and I'd love to take a look at their applications.
And lastly, sir, when we have talked in the past and we've had very frank and honest conversations, you actually talked about sometimes the follow-up is the most crucial, right? The call after that you get that positive, but it's certainly a challenge sometimes as well. Is that still a challenge, that follow-up?
Yeah, what's interesting is that in the communities where we're focusing in on now, we're having a little bit more trouble than across the rest of New York City in reaching people, or about 10% lower. But once we do reach them, they actually have a higher compliance rate with staying at home, which we confirm every day. So they actually are isolating at a higher rate than the rest of New York City. It's a little bit higher, but it gives me that glimmer of hope that people are starting to understand what's going on here and that we can work together.
And I have to ask you one more question about the Orthodox Jewish community. I know we're really out of time here, but they seem to feel like they are being unfairly targeted here, specifically because of enforcement in their areas. What do you have to say to those communities who feel like they are being targeted right now? I know enforcement is not so much your thing; it's another department, but they all go hand in hand, right?
Yeah, I mean, to be very clear on that point, we have zero desire to target, to have people feel that they're being targeted. Our only desire is to look at where the virus is focused and to make sure we're looking around those areas too, to make sure it hasn't seeped out and we haven't noticed it. And then to be able to do what we know works well, testing. We've handed out 1.6 million masks and contact tracing, and you're going to see that equitably provided across the board. And like I said, we've already doubled the number of testing we're doing in our highest risk areas on Friday alone.
All right, and I know the governor he said he's unhappy with enforcement. That is not your department, but they all go hand in hand, sir. Thank you for your time this morning, Dr. Ted Long. Do appreciate it.
Thank you, sir.